I'm Amy, and I am the nurse practitioner student that is going to be doing your focused exam today. Can you give me your name and your date of birth?
Conley Glenn Bowman, Sr., November 11th, 1963.
Okay, can I call you Glenn?
Please.
Okay, Glenn, do I have your permission to upload this video onto YouTube for the purpose of sending it to my class?
Please. Yes.
Okay, perfect. So, the areas that I am going to be examining today are going to be your chest and your back area. I'm going to be looking at two different things. I'm going to be looking at your respiratory health and your cardiovascular health. So to start with, do you have any history of cardiovascular disease?
No.
Do you have high blood pressure?
No.
Do you take any medications for your heart health?
No.
Okay, as far as respiratory, do you have any shortness of breath?
No.
Okay. Do you have any pain on breathing,
No.
cough, or congestion?
No.
Okay. And since we're talking about cough and congestion, are you up to date on your COVID vaccines?
COVID and everything else.
What other ones have you had?
I don't know, but they check it every time I go to the
Okay.
doctor, so
So you
I like all vaccines.
okay. So they've also given you the pneumonia vaccine.
Have had pneumonia. In fact, my wife administered it.
Okay, perfect. So the first thing I'm going to do is I'm going to visually inspect your chest. So I'm looking for things like trauma, which I do see two areas that look like trauma to me. They actually look like surgical scars. I see one right here, and I see another one right here. Would you tell us what happened?
Yes, I had Burkitt's lymphoma in 2007, and this is for Metaport, and at that time, for just my IV, and then afterwards they thought that I had some other type of lymphoma, and the test showed it was concentrated here. And so the thoracic surgeon went through here behind my ribs and was snipping, I guess, biopsies to see what type it was. And I guess, in fact, whether it was cancer or not.
Okay. So you have a history of Burkitt's lymphoma,
Yes.
but at this time it's in remission and you don't have any other type of cancer.
Correct.
Okay, perfect. So outside of those two areas that I see, I'm looking at things such as discoloration or distended veins or anything like that. I don't see anything like that. So I'm going to move on to examining for his breathing. So what I'm looking at here is I'm looking to see, is the rate even? Is he able to inhale equally on both sides? Does he have increased work of breathing? I don't see anything abnormal. The other thing I would look for is any type of accessory muscle use, because that can be a sign of respiratory distress. I don't see anything like that. Okay, so let's move on. I'm going to palpate for tactile firmness. I'm going to use the palm of my hand and just keep breathing. And I'm feeling this I'm palpating to see if I would feel something like air underneath the skin. But I'm also, as he's breathing, I'm feeling how the breath comes in and out of his body. Okay. So the next thing I'm going to do is I'm going to percuss the chest. So percussing is a little weird. It's where I put the fingers on like this, and I'm going to kind of tap at the joint. What I'm doing by doing that is, if I tap, I can tell if there is something solid under there, for instance, on the bone, or if it's not solid, which is what I'm thinking, what I'm wanting, for your lungs, okay? And so I'm going to go all through the lung fields that way. You can kind of hear that noise, so it sounds hollow.
Yes. I couldn't do it because the rib. Okay.
on to listening. So I'm going to listen to your lungs right now, and then I'm going to do the posterior, and then I'm going to come back and listen to your heart. So right now we're just looking at the lungs.
Okay.
All right. So I'm going to start at the very top. You'll take, just whenever you feel this, just take a deep breath in and out. Okay. And I'm listening to hear if I can hear the air coming in and out of your lungs, if there's any adventitious sounds, any wheezing, any wails. I don't feel anything like that. So the next thing I'm going to do is it's an exercise that's a little different. Each time you feel, hold on just a second. Each time you feel this, I want you to say 99. Okay?
99.
Okay?
99. 99. 99. 99.
Okay, we're going to do it again, but this time you're going to whisper it.
99.
Okay, and then one last one on this side is each time it touches, you're going to say E.
E. E. E. E. E. E.
Okay. All right. So now I'm going to have you turn to face the wall. And we're going to work on the posterior side. Okay, same thing here. Visually I'm going to inspect. I don't see any signs of trauma, any abnormal coloration. I'm going to watch his breathing from this side. And it's even on both sides. His rate of breathing is relaxed. I don't see any increased work of breathing. So I'm going to go ahead and do basically the same thing I did on the other side. And that's going to start by percussing. Okay. Whoops. And I don't want to do it right there because there's the scapula. Okay. Same thing, I'm going around the edges of the lungs. Okay, do you remember when I had you take the deep breath and hold it?
Yes.
Okay, I want you to do that again for me. Okay, let it out and hold it. Okay, now do it one more time for me. And hold it. Now what I'm percussing here is the diaphragm, and you can let it out and hold it. Same thing. Okay. The next thing I'm going to do is listen to your breath sounds, very much like I did in the front. I'm going to just, at first, each time you feel the stethoscope, just take a deep breath in and out. All right. Okay. I'm just making sure to get all the lung feels. All right, so then we're going to repeat. We're going to repeat the exercise that we did on the other side. So each time I touch, I want you to say 99.
99. 99. 99. 99.
Okay, and then if you'll say, or excuse me, if you'll whisper 99.
99. 99. 99.
Okay, and this time if you'll say E.
E. E. E. E.
Okay, so now we're going to move on to the cardiovascular part. So if you'll turn back around. Okay, so for this one, I'm going to be doing a couple of things. I'm going to be looking at your jugular vein to see if it's distended. I'm also going to be palpating your carotid arteries, and I'll be listening to your heart. Okay? So we're going to start with the jugular vein, and what I need you to do is kind of turn your head like this. Very good. Okay. And I wouldn't want to start it up here because there's a reaction in your body that'll make your blood pressure drop. We don't want that. Okay, and I'm not feeling it, which is a good thing. I'm moving into the sternal notch. And I can palpate it right there. And it's even and it's regular. I don't feel any bruise or anything like that. So I'm going to take a measurement.
Do I keep my head?
You can take it up for a minute if you need to rest. Okay, you ready?
Okay, yes.
So what I'm going to do is put the ruler right here. And then I'm going to palpate again. Oh, I need to turn the ruler where I can see it. There we go. Okay, so I'm going to palpate where I can feel it, and then I'm going to use the paper. And I got just over 1, which is great. You want it to be under 3. So what that tells me is that your jugular vein is not distended. So that means that there's not blood that's backed up into this area. Okay?
Okay.
So I'm going to set that down. And then I'm going to get your carotid artery. You wouldn't do both at the same time because that could cut off blood flow to the brain. We don't want that. Okay. So it's even. I don't feel any bruise or anything. I'm going to go ahead and palpate the other side, and then I'm going to listen to both sides also just to hear the blood flow. Okay, same thing. I'm going to come down here. Even, regular. Okay, and now I'm going to listen to it. Okay, I'm going to switch to my bell, or excuse me, my diaphragm actually. There we go. I'm going to listen to the other side. Okay, sounds good. All right, so the next thing I'm going to do is I'm going to palpate around your heart to find the point of maximum impulse. So normally what we're going to do is go down the sternal notch. Okay, and then on this side I'm going between the 5th and 6th rib. So I'm not trying to tickle you. And then I'm going to come. Together we make it out. Okay, I don't feel any thrills or bruise. So now I'm going to auscultate your heart. Same thing, I'm going to start here, work my way down. And I'm going to start with the diaphragm, which catches the higher pitch sounds and any abnormal sounds. So I'm going to start looking for the aortic valve. I'm listening to hear it close and make sure the blood doesn't sound like it's turbulent or hear any extra noises. Okay, pulmonic, same thing. Tricuspid. And mitral. Okay, and now I'm going to switch to the bell, which on a traditional stethoscope is the smaller, and that gets kind of the lower frequency sounds and things like heart murmurs. So I'm just going to listen again to each area. Okay. I don't hear anything abnormal. It sounds good.